So more about the vet visit. How about that annual exam for your adult pet, your adult dog or cat? So what do we need to discuss and expect from that visit? Well, first of all, don't just show up to check it off your to-do list because you got a reminder card. You need to be prepared and you need to go in there with your own agenda and things you want to discuss. So with that in mind, don't send your college kids who are home on summer vacation or spring break, and don't send your husband who doesn't know anything about the dog. The person who takes care of the dog and pays attention to the dog and runs the household is the person who needs to be there to discuss things about the dog or cat. Okay? So what you want to talk about are things that you've been looking for all year long. You need to be paying attention to your pet the same way you do your family and your kids and everything else. So any changes in behavior or attitude or lifestyle or mobility or the human schedule or the pet schedule. Are they drinking more? Are they peeing more? Are they drinking less, peeing less? Having trouble pooping? Not getting up and moving around as well. And that's not always obvious. Maybe they're just not meeting you at the door when you come home like they used to. Or they're not as excited to get up when they hear something outside or when it's time to go out. Those are subtle ways of them saying that they don't feel like getting up. You need to be looking at, has your schedule changed? Have you done some remodeling in the home and stirred up a bunch of mold or other construction dust that can be making the dog or cat sick? Cats' lungs are very, very sensitive. Changes with your neighbors' pets, neighbors' people, lifestyle, people in the house, anything and everything. You need to be paying attention to what has changed with the pet and the pet's situation and lifestyle. Even if there's someone sick in the home, an undiagnosed health problem with one of the humans, talking to your vet about that, the same thing could affect your pet. And the vet may be able to help you figure out what that is, even if there's a sick person in the house. So, with all these changes, you need to discuss them with your vet. Even if your vet doesn't know what to do, just recognizing that there are changes and things happening that we don't understand is a good way for your vet and you to think, well, maybe we need a more holistic approach. Maybe we need to talk to someone else about this. And that would be great because as a holistic vet, we want to work alongside and in concert and in tandem with your vet. Those of us like me who don't do blood work and things and x-rays and just do house calls, we need to have a vet, a regular vet like yours, that'll do the blood work and x-rays. And then if they don't know what to make of it or they're not sure about it or they think it needs a different approach, send it to us and let's work together. So that would be great. That doesn't happen very often, but that's the way it should be. Because remember, the Western regular trained vet, they're going to find things that have already happened. Their exam finds things that are wrong, that are already there. And we want to try to find things based on these subtle clues and cues of behavior changes and lifestyle changes to try to find something before it's all the way wrong and all the way broken and try to fix it before it gets there. So, one example of this, one thing I see really often is mobility, honestly. So, your dog is limping at some point when it's young and they give it some NSAIDs, or your dog's older, 5 or 6 years old, and they're starting to limp or not get up as well, like the things I discussed that you're supposed to be watching for. So the regular vet's going to put your pet on an NSAID, non-steroidal anti-inflammatory drug. Very common. People take them all the time. People take things like ibuprofen. The pets, the very similar drugs are Rimadyl, Previcox, Daramax, Galliprant, Carprofen. These anti-inflammatories, though, they basically mask the signs and symptoms of any orthopedic issues or inflammation in the body to where the underlying problem just keeps getting worse. It's the same with most other chronic conditions in pets, whether it's something about heart disease, a heart murmur. Well, we'll just check it next year and see if it's worse, and it will be worse next year. Kidney function. Oh, the kidneys are getting bad. Let's change the diet to some dry prescription food that's just as bad for the kidneys. Behavior, seizures, allergies, itchy skin infections, ear infections, atopy, anything else. The Western approach is to suppress the symptoms with some drugs, steroids or Cytopoint or Apoquel or something that causes other problems in the body. And we want to try from a holistic approach to find the source of those problems early on, because by the time you usually come looking for acupuncture or chiropractic or holistic, or by the time your vet recommends it, it's 3 or 4 or 5 years into the problem. Your dog's been on Rimadyl for a lameness for 5 years and now can't get up off the floor. And you want us to fix it with acupuncture and chiropractic. Well, 5 years ago was the time to fix that before it got to this point. Same thing with the seizures and skin issues and everything else. So The point is that your pet's health is your responsibility. You need to be paying attention to what's going on with your pet at home, and you need to be challenging your vet, not from a negative point of view, but what can we do to fix this problem or make it better, not just mask the symptoms. What can we do to fix it? You need to be the one to advocate for your pet's health and longevity, because you're the one who's going to have to deal with the consequences of the illness and orthopedic problems as your pet ages. So pay attention to what's going on at home and be prepared for your vet visit to talk about all these things. Thanks.